The preferred venipuncture antiseptic is A. Betadine, B. Iodine, C. Isopropyl alcohol, D. Formaldehyde. The correct answer is C. Isopropyl alcohol. Which of the following describes the result of an individual who has recovered from and developed antibodies against a certain virus? A. The individual is susceptible. B. The individual is immune. C. The individual is a carrier. D. The individual is infected. The correct answer is B. The individual is immune. Universal procedure guidelines that refer to the process of aliquoting mixed tube state that a healthcare worker A. May immediately mix the tube by inverting the tube into a centrifuge at least 6 minutes at a force equivalent to 1250 to 1600 times G. B. May recentrifuge any tubes accidentally mixed during pipetting that resulted in plasma contaminated with red cells. C. May reuse any pipette tip for multiple draws as long as they have checked that it is free of DNA contamination. D. Must perform aliquoting while cryovials are warmed. The correct answer is B. May recentrifuge any tubes accidentally mixed during pipetting that resulted in plasma contaminated with red cells. The origin of blood cells is the A. Lungs, B. Heart, C. Bone marrow, D. Capillaries. The correct answer is C. Bone marrow. WBC are composed of approximately 20 to 40% A. Eosinophils, B. Lymphocytes, C. Neutrophils, D. Basophils. The correct answer is B. Lymphocytes. Histamine is carried by which WBC? A. Basophils, B. Monocytes, C. Eosinophils, D. Neutrophils. The correct answer is A. Basophils. What is another name for thrombocytes? A. Platelets, B. Monocytes, C. White blood cells, D. Red blood cells. The correct answer is A. Platelets. The function of a leukocyte is A. To carry oxygen to cells, B. To aid in the formation of clots, C. To protect from infection, D. None of the above. The correct answer is C. To protect from infection. The typical lifespan of an RBC is A. 45 days, B. 9 to 12 days, C. 365 days, D. 120 days. The correct answer is D. 120 days. What type of blood do the arterioles and arteries carry? A. Oxygenated, B. Deoxygenated, C. Both, D. None of the above. The correct answer is A. Oxygenated. What does CSF mean in the clinical laboratory setting? A. Clinical spinal fluid, B. Cerebrospinal fluid, C. Clinical serum fluid, D. Cerebral serum fluid. The correct answer is B. Cerebrospinal fluid. When following proper finger puncture technique, the phlebotomist may do all of the following except A. Wipe away the first blood drop you see, B. Vigorous massaging or squeezing, C. A puncture either the ring finger or middle finger. D. A puncture parallel to the fingerprint whorls. The correct answer is B. Vigorous massaging or squeezing. A PKU test on an infant is performed on which part or region of the body? A. Forehead. B. Toe. C. Finger. D. Heel. The correct answer is D. Heel. A tourniquet should be tied 4 inches above the needle stick site. A. 1 to 2. B. 3 to 4. C. 4 to 5. D. 2 to 3. The correct answer is B. 3 to 4. Choose the preferred site for venipuncture. A. Thrombotic vein. B. Antecubital fossa. C. Elbow. D. Ulnar vein. The correct answer is B. Antecubital fossa. The recommended depth of an infant heel puncture is A. 2.0 millimeters. B. 1.2 millimeters. C. 3.0 millimeters. D. 0.02 millimeters. The correct answer is A. 2.0 millimeters. When attempting a hemoglobin blood draw on a patient in intensive care, and 4 is already in the left arm. Additionally, there's no suitable antecubital vein or hand vein in the right arm. What do you do? A. Ask a professional for assistance. B. Attempt to draw a hand vein below the 4. C. Prick a finger on either hand. D. Draw the specimen from an ankle vein. The correct answer is C. Prick a finger on either hand. In capillary specimens, the first microcontainer tube color in the order of draw is A. Green. B. Red. C. Lavender. D. Gold. The correct answer is C. Lavender. When selecting the site for phlebotomy, it is recommended that the phlebotomist A. Discard the blood sampling device. B. Recheck labels on tubes. C. Extend a patient's arm and inspect the antecubital fossa or forearm. D. Introduce yourself. The correct answer is C. Extend a patient's arm and inspect the antecubital fossa or forearm. Which layer of the heart is the endocardium? A. The outermost layer. B. The middle layer. C. The innermost layer. D. The bottom region. The correct answer is C. The innermost layer.